Hi, everyone. Thank you so much for joining us on this very rainy Wednesday afternoon. My name is Lauren Walk. I'm the senior news editor for the Sun Herald. I've been here on the coast for about 10 years, and I'm here to introduce our newest reporter, Isabella Murray, who's been with us for a couple months now, and I just wanted to explain how we were able to bring her on board. There's Isabella. So as part of a class with the local media association, myself and our executive editor, Blake Kaplan, went through a 6-month process with a bunch of other newsrooms with news outlets of all shapes and sizes from all over the country, digital startups, newspapers that have been around 100 years. And we figured out how to fundraise for community-funded positions. We went to community leaders here on the Mississippi coast to identify issues that were important to you and that were important to readers. And then we settled on a topic, which was the coronavirus and specifically vaccine coverage. And we were able to fundraise from some amazing donors for a position for 6 months. And Isabella Murray graciously accepted the position and has been doing some really amazing coverage. And I encourage everyone to check out her stories on sunherald.com. And now I will kick it over to her to introduce our 2 amazing health experts from Singing River Memorial who have agreed to join us.
Thanks, Lauren. So thank you for joining us for a live conversation about pediatric coronavirus on the Mississippi Gulf Coast. As Lauren mentioned, I'm Isabella Murray, and I'm the coronavirus vaccine reporter for the Biloxi Sun Herald. So most Gulf Coast students have been back in person learning for about a month, and that month is the month that the Delta variant has surged across South Mississippi. Over 20,000 students have been quarantined in the 6 weeks that the Department of Health has reported cases in public schools, and there have been 7 pediatric COVID deaths. At the same time, the Gulf Coast has continued to see stubbornly low vaccination rates, despite health officials' claims that the shots are the best defense against the virus, and especially the Delta variant, which has impacted children at exceedingly high rates. We're fortunate to have pediatric experts here to help us make sense of what's happening. I'll ask them both some questions, and we've compiled a list of questions based on reader feedback as well, and we'll throw that into the discussion every once in a while. Our first guest is Dr. Tyler Sexton, who is the medical director of Singing River Pediatrics. Over the course of the pandemic, he's worked with many COVID cases in children as the chair of pediatrics and wound care. And next we have Dr. Michael S. Wiederhold, or Dr. Mike, and he is a healthcare administrator who's been recently brought in by Memorial Hospital at Gulfport to help oversee the health system, and he is a pediatrician by trade. Thank you both for joining us.
Thank you.
So I want to start off with some data from your respective hospitals. I am wondering, I guess we can start with you, Dr. Sexton. How many children has Singing River seen during the pandemic, and how many of those cases have been a part of the Delta wave?
Sure, and thanks for having us on. We're honored and privileged to be with you guys today. So since day one of this COVID pandemic, we've had about 17% of our population have COVID-19 be pediatrics or 18 years, 19 years old or less. Of that number comes out to 3,230 cases. Most recently, that's in the entire course of this wave. Recently, in terms of the Delta wave or the 4th wave that we've been dealing with, we've seen a big influx or a big spike in these pediatric patients, and that has now seen a lot more of our inpatient volumes. Over the last month, we've had 20 inpatient that needed that required, some sort of care, whether it be respiratory or with the MIS-C or the multi-system inflammatory syndrome after COVID that we've been seeing. So we've definitely seen a larger spike during this 4th wave.
Okay. And then what about at Memorial, Dr. Mike? How many children have you guys seen during the pandemic, and how many in that Delta wave?
At Memorial, we've seen a very similar spike during this 4th wave with Delta. Our pediatric testing has really mimicked the adult testing, where it was slower early on, and then the 4th wave it's really taken off. And our positivity rate has also been very similar to adults. We had a peak around last Christmas and New Year's with about 25% positivity rate. But now we have another positivity rate increase, but this one is slightly different. It's still around 25% positivity rate, but it's been lasting for weeks and weeks, as opposed to the earlier wave before. It just lasted for about a week and then it started to trend down, but now it's continuing. There might be a slight drop off that we've seen in the past week, but we still have to wait to see what happens with that. The other thing that we've seen with our admissions is that of our admissions, 57% of them have really come in the past 2.5 months for our kids for our population under 18. So we've really seen all year long, since we've had coronavirus, 57% of those patients that have been admitted to Memorial Hospital at Gulfport have occurred in the past 2.5 months since July. So it's definitely a big increase in the pediatric population. And we also stratify by age, and with this Delta wave, it's really affecting people that are younger. It's more around people that are 40 and younger, 30 and under. That's where it's really been hurting. And of course, the pediatric population being in there, anyone under the age of 18.
Okay, so obviously we can observe that the Delta wave is much more serious in children and much more transmissible. Dr. Sexton, I know you have clinical experience with some of these pediatric patients. What do you think is the most concerning part about Delta spread in children from what you've seen on the ground?
Sure, that is a great question. A year ago, I would say it was a blessing to be a kid because COVID-19 really didn't affect these children the way that we're seeing it now. Now, still the vast majority, both in the clinical setting, outpatient, still do well. It's still a more mild disease in the pediatric population, thank goodness overall. The difference that you're seeing with this Delta wave, however, is the virulency and how much more it affects these kids, how much more severe. Like I said, a year ago, these kids really next to none were getting admitted by any means. It was all outpatient, supportive care, very basic care. Now, though, you're seeing a lot more that are affected with COVID that require inpatient, more of the, bronchiolitises, the respiratory distresses, and a lot more of these comorbidities with, genetic issues, CP, special needs. These kids are getting affected much more highly. The other thing is these younger populations, the MIS-C, or that multi-inflammatory systemic inflammation after COVID, that's what we're seeing a lot more of at Singing River and just around the Horn. In Mississippi, with some of our colleagues that we've been speaking to as well, that's where it's like a Kawasaki's-like syndrome, except the entire body goes into, angry inflammatory, and you see a lot more what's called hemodynamic instability, which means basically their bodies get sicker, the blood pressure's bad, and that's where you see more of the heart disease, the myocarditis, which is a side effect or an issue with COVID-19. And so that's what we haven't seen before, and it's affecting a lot more of these kids. And that's what's requiring them to be inpatient, is with the MIS-C or with more of the respiratory distress things, especially in your 16, your 16, 17-year-old population. They're now presenting a lot more like these adults, requiring some symptomatic oxygen, high flows, BiPAPs and things like that, and requiring some of the antiviral therapies that we didn't see before.
Okay. Is the pediatric care different from, general COVID care? Are these kids using ventilators at all? You see these pretty alarming images of, especially, during Delta on the coast, but are kids kind of, receiving that same type of care?
Well, that's a good question. Overall, the care is still similar, especially, like I said, in the adolescent population. The care is still similar as an adult. You're using your decadrons, your high flows, your remdesivirs, your antiviral therapies. These are still going to be kind of the same standard of care across with these adult populations. And there are a few that need to be innovated, yes. We always say, oh, it's only 1% or it's a small number. It's always a big deal if you're the 1% affected, right? And that's why we care so much about these kids. We don't want to see anybody, well, let alone anybody, but especially pediatrics, be affected like this, right? So yes, the care in terms of your adolescents still ranges about the same as any of your adults, right? Getting the monoclonal antibodies, supportive care, and your oxygen. The big difference is these younger kids having the requirements of the steroids because of the MIS-C or the IVIG. That's the big difference. And this COVID-19 Delta variant in what we're seeing is a lot more of the abdominal pain and more of these severe secondary organ system failures or being affected like that. And that's the biggest difference. So to recap, The older population, the 16, 18-year-old adolescent population for us, about the same in terms of your pediatric population. I'm sorry, in terms of your adult population. But your younger kids, those are the ones that are much sicker and requiring a lot more interventions.
Okay. Okay. Now, I know both Singing River and Memorial don't specialize in pediatrics in terms of, along the coast in New Orleans and in Mobile, and even up in Jackson, there are pediatric hospitals. Dr. Mike, you oversee population health at Gulfport Memorial. How have you dealt with the influx of younger patients? Are you needing to transfer these patients, or how are you able to kind of adjust the practice to younger swaths of people?
So right now we treat them like we normally do. We're able to absorb them into our health system, bring them up onto the pediatric unit and take care of them there. The one difference with the Delta wave is that's when we've had to transfer out to children's hospitals, just two. We've only had to send 2 patients out to children's hospitals for a higher level of care. And those patients generally have comorbid conditions, so they're generally seen by some sort of specialist for whatever condition they have, whether it's heart or something else. And those are the ones that are really have the more severe outcomes, or the ones that you're worried about. Because the interesting thing with children is that they're able to compensate pretty well, and they will somewhat fool you, and you think that they're not that sick. But once children no longer are able to compensate, they decompensate quickly, and they get sick quickly. And that's the one thing that's different with pediatrics that a lot of people don't realize. With adults, you can kind of gradually get sicker and sicker. With the kids, they're able to compensate, they look pretty well, and all of a sudden they just crash and they look bad. But like I said, we've been generally able to take care of these patients. They haven't been too sick. They are sicker than they have been with the other variants. The Delta wave does tend to have a little bit of a sicker profile, it appears. And then, of course, the post-COVID syndrome type stuff that Dr. Sexton was referring to.
Okay. And Dr. Sexton, how have you guys been able to adjust to the younger patients at Singing River?
So I agree, Dr. Widerhold. One of the things that I came from as a pediatric hospitalist, I came from South Alabama, used to work at Johns Hopkins. We consider, we do have a great pediatric program. We have a lot of inpatient pediatricians and pediatric NPs that are acute care. So we are able to keep a lot of these kids. But like Dr. Mike said, when they do get sicker, we will of course use our specialists when necessary. Thankfully, though, like I said, I've treated quite a few miscees here that are that require inpatient care, and with the influx of the needs of ICU beds and those kind of things up in Jackson, at South Alabama, and at Ochsner's, that has required us as inpatient pediatricians here to do a lot more and to step in and care for these kids on the coast so they can stay here and be safe and be taken care of effectively, because they have such a burden of the bed crunch from all over. That's allowed us to really kind of step up. But we, of course, the vast majority, I would agree, we're still able to envelope and take care of effectively here at Singing River, and we give some excellent care, and they've done very, very well. But when indicated, if necessary, of course, we would transfer them out to a children's hospital.
Very good. And so I want to touch a little bit on the pediatric deaths. The 7 that have happened in the state thus far have been scary to a lot of parents. Most of these patients, as you guys mentioned, are pretty mild, the pediatric cases, but Dr. Mike, as you said, health can deteriorate fast. What are the best ways that people can kind of keep their health up when they do get COVID, especially, children, so they can avoid, another morbidity? Let's start with you, Dr. Mike.
So it depends on the age group. So with vaccines, if you're over 12, you can get the vaccine. And the same thing goes with the monoclonal antibodies. If you're over the age of 12 and you weigh at least 40 kilograms, which is 88 pounds, you're eligible to get monoclonal antibodies if you meet certain criteria. So that's usually people that have some sort of comorbid condition. The way I like to talk about it is if you see some sort of pediatric specialist, you're more than likely eligible to get the monoclonal infusions. And that generally tends to help. I've known several people that have had it, that have had their kids I've had the infusions. I've had the infusion myself because I had COVID last December, and it generally does help you within a couple of days. If you are younger than 12, you're not eligible right now for the vaccine. You're not eligible for the monoclonal antibodies. So there it's more supportive care, symptomatic care, continue to push for fluids so they don't get dehydrated, and monitor their symptoms and breathing to see whether or not you need to go and see your primary care doctor, your pediatrician, or whether you need to come into the emergency department for continued breathing problems.
Yeah, that's something that I found interesting. Monoclonal antibody infusions have been really pushed across the coast recently. And I guess I hadn't realized that children as young as 12 could receive them. Dr. Mike, you said you had a friend. How old was their child who had the treatment done?
So they were exactly or just over 12, and they were just over the weight cut out of 40 kilograms or 88 pounds. And he had a comorbid condition of moderate asthma and got tested, did pretty well for a couple days, but really wasn't improving at all, just acting kind of puny, just kind of wanted to lay around the house and not do much. And she was a little bit hesitant about getting the antibodies, but I encouraged it, and she made an appointment, and then a day and a half later was able to get the antibodies, and within 24 hours was well on the road to recovery. So it could have been much worse situation if, the child continued to get sick, started having the issues with the asthma being a comorbid condition, and then might necessitate a 911 call, an ambulance trip, time in the emergency department, maybe even an overnight stay or even an ICU visit. So the monoclonal antibodies really are a lifesaver for this part. It's not to say that you shouldn't be vaccinated, because the vaccine is the most important thing to do with the primary prevention. But if you do have COVID, really, you should consider getting the monoclonal antibody infusion so that it can help you recover quicker.
Great. And Dr. Sexton, have you interacted with a lot of patients, pediatric patients who have gotten the vaccine? How have children reacted to that?
We have. Not as many in the 12-year-olds yet. That's starting to ramp up in our clinic and just in the system, our system in general right now. But a lot of adolescents, and overall they do extremely well. These vaccines, everyone's always talking about, well, there's always still going to be some breakthrough cases, just like with flu and these kind of things. Is it absolutely perfect? No. But is it a great shield? Is it extremely effective? Yes. And so, as Dr. Mike said, that's going to be your primary, mode of prevention is getting the vaccine. And viral cardiomyopathy, that's another big thing that everybody's talking about. Well, what about the heart issues? And that still is extremely low. Less than 1%, even less than that. And that's, I get it. I have cerebral palsy myself. I've had 16 surgeries, was told I never walk, talk, or even be a doctor. And here I sit in front of you. So I understand the angst the parents have. I understand that even the special needs populations. But I will tell you this, the vaccine is very effective and very safe, and it's been proven to be so. And so the adolescent population that we're seeing actually do very, very well. Very mild symptoms, some none at all. But if you see any, it's just going to be your general malaise, kind of a sore arm. And by the second or third day, they're back doing their thing, and then they get their second dose. They do very, very well.
That's good to hear. Before we get into kind of school, children back in school, and the dangers of COVID in a contained space like that, I'm going to take a quick question from one of our readers. So Christy Moran asks Dr. Sexton specifically. She said, one of the biggest complaints that parents have expressed at recent school board meetings is that masks cause headaches in their children. Have you seen an increase in your patient presenting in clinics for headaches induced by masks? And she has a follow-up, which is, have you seen an increase in patients with anxiety attacks secondary to mask usage?
That's a good question. No, in terms of the actual headaches inducing with mask, I understand, sometimes depending on the age group, it is definitely a different conditioning in terms of training with these kids. And I wish it wasn't something that we had to do. We're not seeing a lot of necessarily headaches induced with them. They still get very good ventilation in these masks. It's still, safe. You're not seeing any sort of adverse reactions to wearing masking kids. It's unfounded. They do very well. I will tell you though, I can agree, and I appreciate the reader asking that question, is anxiety is associated with COVID-19 I am shocked at seeing how much of the anxiety that have ridden through or that have rose through this pandemic in terms of, the fear of contracting or of wearing the mask and those kind of things. I mean, yes, anxieties are higher. We have to be, as primary care, open to meeting these kids where they are and having, discussions. And the best thing we can do is teach these kids and their families that, the social distancing, washing your hands, that's still going to be your best way of preventing this. But, you're right. There are higher anxieties. And even in my children, they ask more questions. And so with that air of uncertainty, we're trying to get as much information out to these kids and to the families so they can disseminate that. Anxiety is a real thing because it's something new and they are not used to seeing their friends in masks. But, right now, that's the best thing we can do to we're making the best decisions we can, globally for that. And at least we'll decrease infection rate or transmissivity rate. But no, in terms of headaches with masks, I can't tell you personally. And of course, across the board, you're not seeing too much of that. But anxiety-induced or anxieties and other things there in terms of mental health have definitely ridden, and we've had to be, more on top of that, throughout this pandemic for sure.
Yeah, at the Sun Herald, we've reported that, there are certain children who are pretty high risk who have decided to be homeschooled or, on both sides, we've been seeing some pretty strong opposition to staying in school, depending on what policies were. Do you recommend that students who are high risk do stay out of school, out of in-person learning?
That's a tough one. I don't know if I would necessarily go right to, it just really depends on the case. I will tell you that. I mean, if you're a child that's got, I've got a couple of our kids that are on hospice care. I do some pediatric hospice for the coast and have some cancer and things like that. Then yes, these populations need to be a lot more acutely aware that any infection, any viral infection, from rhinovirus to the flu, to bocavirus to COVID, could be detrimental to their life and their overall health. These other comorbidities, like your moderate asthmas, your CPs, your Down syndrome, your special needs population, was something that I love and take care of a lot of. You don't necessarily have to. That's going to be a personal choice, a parental choice. Do I think you have to completely come out of school? No, not necessarily. I think that the schools have done the best they can in terms of putting these protections in place. I know in my daughter's school there are, social distances and things like that. They've done a fairly decent job of keeping things, at bay. And so I think there's also, on the other side, if you look at the AAP, and I'm sure Dr. Mike can echo this, in terms of education and face-to-face education and socialization for these kids is very important. And so, what I want to encourage everybody out there, the readers and the watchers alike, is we want to look at overall health. And I know some of this stuff is a burden, or it makes us a little bit crazy. But in face-to-face learning is still going to be critical for these kids. And so you want to really talk to your PCP, your primary care provider, about those risk factors. But overall, unless you have large comorbidities and those kind of things, it still would be safe to do, to still do in-house schooling. But that's going to be something you need to gauge as a family as well.
Yeah,
Dr. Mike, yeah.
Dr. Sexton is right now. The American Academy of Pediatrics has been very vocal that in-person learning is best for the students, for their socialization, for their development as a person. So the best thing that you currently do is have a layered prevention strategy. I know Memorial has been involved with all the school districts here in creating very well laid out plans to return to school, and what does that look like, and things like universal masking, regardless of vaccine status, for when you're indoors. And also the CDC recommends for schools to try to be 3 feet apart, even indoors, even with a mask. And then promoting hand hygiene, proper covering of your nose and mouth when you sneeze or have other respiratory secretions coming out. And this layered approach, which also does include some contact tracing and screening of kids that have been exposed to or been around people that have been COVID positive, is part of that layered approach. That layered approach is really the best way to have in-person learning right now.
Great. Yeah, that's what I was going to kind of touch on was, there have been about 20,000 students thus far that have been quarantined. Is quarantining a student really necessary when they've been exposed? I'd love to talk a little bit about, there's this sort of COVID math going on where parents are having to add or subtract based on exposure or quarantine. Dr. Mike, why don't you take this? Can you lay out for us what a student should do if they're exposed to COVID, and what quarantine times look like and all of that?
Mm-hmm. So it does get a little bit confusing, which I can understand. So isolation means that you are positive and you do need to be removed from the general population until you're no longer contagious. With quarantine, you've been exposed to someone. We need to remove you from the general population so that we can determine if you will develop the disease, because during that time period when you're in quarantine, you are likely to transmit the disease to others, so it will just keep growing. So that's just the basic definitions of quarantine versus isolation. Now, it does become a little bit confusing when you look at some of the agencies that are out there and what they say, the CDC versus the State Department of Health. CDC says 14 days for most things, but they do have a caveat where local health authorities can change that. The State Health Department has pretty much done a 10-day quarantine and isolation. So if you're exposed, you can be quarantined for 10 days under most conditions. There are some caveats where it can be less than 10 days, but that's in particular, and you should talk with your doctor about that if you can meet one of those criteria. But we remove you from the general population for 10 days, and then you should also be tested around days 3 to 5. And actually, the CDC is now recommending that for the school population to have post-exposure testing for 3 to 5 days, regardless of vaccine status and regardless of the absence or presence of symptoms. So that was a recent change that came out on the 4th of last month. But we remove you from the general population and just monitor you, just make sure that you don't develop the disease and expose it to others. And then you're able to rejoin your school and start your normal activities.
Great. I think we're going to go to another reader question. We sort of already touched on this, but I just want to kind of consolidate an answer. Kathy Wu asks, what's the best way for kids to avoid infection in school? Dr. Sexton, do you want to grab that one?
Sure, that's a great question. And the biggest one is going to be hand washing and general hygiene, right? And then mask and social distancing. Right, so your 3 to 6 feet is a big one, and then wash your hands. That's your biggest one, right? Wash your hands and stay distant. So it's still any other respiratory virus you're going to have that it's going to affect and can enter any of these areas or orifices that are can be exposed. So as long as you're washing your hands and you're getting a good distance, because it's a droplet infection, of course, it can go further, but as long as you're washing your hands, keep a good distance. That's your safest bet. Good hand washing and distance keeping, not swapping masks, not sharing foods, those kind of things. And like I said, overall, like Dr. Mike said, most of these schools, and we've been a part of that as well in terms of Jackson County and around in terms of keeping these protocols safe. These schools have done a decent job in terms of trying to, create a safe environment of distancing and then a lot of hand washing and sanitary precautions for these kids. And that's your biggest way to avoid and kill, the spread of COVID-19.
Dr. Dobbs has been quoted saying, if his children were in school, he might keep them out of extracurriculars. Is that something that you guys would recommend, or how does that look? A lot of these kind of extra activities. I know that being in school is important for kids, as you said, Dr. Mike, but what about some of these extra things outside?
So I think it really depends upon the activity that you're doing. If you're able to maintain a distance, if you're doing something like cross country, you're able to try to keep 6 feet apart. I think that's easy, except for some of the races where you're closer to other athletes. For other things right now, I know it's football season. That's a very difficult one, because I know a lot of people are interested in football. They're interested in their senior year. They're interested, are they going to continue that in the collegiate program? Are the scouts going to see them so they can go and get a scholarship for whatever college they're looking at? That becomes a much more difficult situation, because to tell them to wear a mask during football practice is hard. To tell them to stay 6 feet away during football practice is hard. And we're definitely not doing the same level of testing like the NFL or the colleges are doing at the high school level. So that really just becomes a really personal decision that they have to decide of whether or not they want to expose their child or remove their child. But for other activities that you're able to maintain a distance, I think it's fine. But unfortunately, for most of the most of the extracurricular activities, it does involve being within the 3 to 6 foot marker, and a lot of them are difficult to wear masks.
Thank you. I'm going to take another reader question from Stacy Keeger, and she kind of asks a more general Delta question. But as we said, Delta's very transmissible with children. How long does from exposure to Delta to onset of symptoms? So I think she's asking how quickly from exposure to Delta do symptoms start up, and then what typically are the first symptoms and how long do they last? I know, they are a little quicker with the Delta strain. So Dr. Sexton, do you want to grab that one?
Sure. So it is a little more virulent for sure. You're still looking at that. When you get exposed, you're looking at 3 to 4 days. But before you probably start seeing symptoms, and then you can start seeing symptoms within that 10 to 14 day period. That's where that, like you said, Dr. Mike was talking about the changes in all these different quarantines and things like that. Delta variant is definitely one that's going to attack a little quicker and present with symptoms a little bit quicker in these kids. The general consensus, though, is still about a week, 7 days, that you're going to start seeing symptoms that will manifest. It could be COVID-19. Now, the real tough one is not so much, presenting the symptoms, is how they're going to present. Because you got some kids that will present nearly asymptomatic, maybe just a runny nose, a cough. Some will have fever, trouble breathing. It is very, very vast. Still, the vast majority, though, are going to be, fever, malaise, cough, runny nose, congestion, and a typical URI type symptom. But like I said, it's so vast that it's hard to directly pinpoint. The other thing I will tell you that we're seeing, and you can see a lot of evidence, and also locally here with the Delta variant, is a lot of abdominal pain. More diarrhea, some nausea. We're seeing that a lot more in this Delta variant, especially when you have more of that inflammatory aspect, or a little bit sicker of these kids. It causes pretty severe abdominal pain, almost to the point of, we would talk about, appendicitis or gallbladder kind of diseases. That's how they would present, and it ends up being COVID, and just it inflames that mesentery and the tummy. So a lot of stomach pains, things like that is another kind of an underlying symptom you guys just need to be aware of.
Definitely. And then I did want to ask too, Dr. Sexton, how are children faring? Is the fear sort of up if they are having really bad symptoms? How is that sort of morale with some of these children?
That's a great question. I will tell you, these kids are just absolutely beautiful. They're resilient. Overall, we pride ourselves on having a great relationship. I know in our population, in terms of my clinic and inpatient, and also across the board in terms of St. River, the kids that I get to oversee and take care of, the vast majority are in good spirits. Are there some fears? Sure, there are. And there are some legitimate fears in some of the older adolescent populations, what this is going to mean for schoolwork if they're highly driven, or if they're really afraid and fearful of morbidity and mortality. Overall, though, these younger kids, man, they just keep cruising. They keep doing what they do, have a little bit of symptoms, and they keep going. The big thing is like I said, it's a relationship. And so for all the parents out there, it's okay to be afraid. Just, I hope you found a PCP and a provider that you can trust, that you can talk to. That's one of the things that we try to pride ourselves on, is an exceptional experience that you can come in and talk about your concerns. But overall, these kids, the morale is still high. We don't, at least when you get admitted for us, in terms of COVID-19, we don't, it's not a negative. It's something that we're going to band together, and we're going to get you better. We talk about this with any virus. We're still seeing a lot of these viruses, or COVID-19, causing like bronchiolitis, mild cough, and dehydration, pushing fluids. And so a lot of these kids are still just mild symptoms that we have to kind of coach these parents through and what to look for. But overall, morale is still, it's always sad to be sick, but overall, fairly decent.
All right, I'm going to address a couple more, I think 2 to 3 more reader questions, and then we are going to wrap up here. Thank you both for being so great, this panel. So first, I'm going to ask, we have from a reader named Rachel, can children get a third vaccine, a booster shot? Dr. Mike, can you answer that one?
Yeah, so right now the third booster is, I'll say, slightly controversial. We know it was released by the White House about the third booster, and if you look at the FDA and CDC, they kind of have a little walk back from that statement, but I know September 20th, the White House is doing the third booster. If you meet the criteria and you are over 12, then you can go ahead and get the third booster. But right now, there's a little bit of pause and question about the mixed messages that are coming from the federal government right now. But I do think that a third booster probably would be useful. When you look at the best data that we have for this comes from Israel. So when you look at some of the Israeli data, it does make sense to have a third booster. I think a lot of the question right now, at what point is it 5 months, 6 months, 8 months? But right now, what the White House has released was the 8 months for the third booster for the general population starting on the 20th of the month. Right now, you can get your third booster if you meet the criteria that they have outlined, which is generally more moderate to severe immunocompromised individuals. And for them, that it's been 8 months also since their last vaccine, or since they completed the vaccine series.
And that would include children as well, those
Yep.
12 and, okay. Great. And then one from John Kochik asks, are unvaccinated parents taking ownership if the child got it in the household? Dr. Sexton, you're in clinics with children and parents. Have you seen anything like that?
That's a good question. I mean, we don't by any means do any sort of shaming or whatnot. I mean, these parents, wherever the vector would be. I mean, if the parent was, positive, it's hard when you're in a household and you're a parent and these kids are running around and you're trying to quarantine. It's difficult, right? Especially these single parents trying to manage a group of children. How are you going to quarantine, take care of your family, not get them sick, wear a mask? So I don't think by any means would I say that is there necessary an ownership that parents say, oh, it's my fault, I got them COVID. I'm not seeing that by any means. I think that they are, our parents come in and say, hey, I've been exposed, or I'm positive, I want to get my kids checked, or we have symptoms. What do we tell them? We say, hey, assume you're positive, do your quarantine, or if they're sick enough, we evaluate them. So, they definitely, family units, that's the problem with this disease. When you're in close contact as a family unit, your entire family is probably going to get COVID. That's the reality of it. Even though you're trying to do some things at home and you're trying to, clean and those kind of things. But, single family homes, hard to do. And I know this, being a pediatrician or being a father doesn't make me a better pediatrician. Having kids makes me a better pediatrician, excuse me. I know it's hard to live life and raise your kids. And so, there's a lot of grace there and they're doing the best they can, especially in single family homes. It's just inevitable that this virus is going to spread in these family households. So the key is to quarantine as a family and do it together that way.
Great, thanks. And then, Dr. Mike, why don't you take this last reader question? Somebody asks, how would you know the difference between COVID and RSV, which is respiratory syncytial virus, in young children? I'm not sure if that's too in the weeds, but why don't you take a stab at it?
So that's a great question, because it's starting to become the cold and flu season, and RSV in kids always runs rampant in the wintertime, and ICUs are generally full, or the pediatric ICUs are generally full in the wintertime with RSV, especially with the younger children. They get the bronchiolitis, like Dr. Sexton mentioned earlier. So unfortunately, right now, they do have a very similar presentation. So the best way to tell the difference is to actually come in and be tested. And we can test you for RSV at a number of places. At some clinics can do it. Other times it's just in the emergency department. It depends on if your clinic is able to do it. But the most important thing is to come in and be tested. If you have some of the symptoms, like Dr. Sexton mentioned, that are a little bit off, atypical, neurologic type things, dizziness, then you're going to kind of raise your eyebrows and think, well, maybe this is COVID. But if it's more of the runny nose or severe runny nose where it's very thick, then it's probably going to be RSV. But COVID presents as many different ways, so I would still want to be tested. So the most important thing is come in for testing. For Memorial, we have several testing sites. We have the Iberville and our Gulfport drive-in. Almost all the pediatric clinics, all of our family practice clinics can come in and be tested. But overall, the most important thing is just to make sure that you get your vaccine. And we have several vaccine clinics in Bay St. Louis, Gaucher and Biloxi, and then also most of the clinics are able to do the vaccine. We have the tagline here that we like to say, don't hesitate to vaccinate. So everything else that we've talked about is nice, that you can give antibodies, or we can treat you after the fact that you had COVID, and we can do supportive care in the emergency department or as an inpatient, or unfortunately sometimes in the ICU. But we do have great strategies to reduce this, and this involves having a layered prevention strategy that includes the hand washing that we keep talking about, masking up, trying to stay 3 feet away if you're indoors, trying to have contact tracing if someone's exposed, quarantine and isolation. You know, it seems to get old talking about the same stuff, but then also making sure vaccines, that get your vaccines. That's another layer of prevention. And that's one way that we're going to be able to get past this here in the Gulf Coast, is have this layered prevention strategy to help us get past this Delta wave and go back to regular life.
And let me echo that too, that Dr. Mike said, just so you guys know, same thing. I know that Memorial's doing some great walk-ins and drive-ups as well. We have the same option for those guys at Gulfport, Pascagoula, Ocean Springs, drive-through COVID testing, and also your walk-in vaccines without an appointment, Gulfport and Pascagoula. Just want to make sure that Jackson County, everyone knew, like I said, on each side, you know, there's a lot of opportunities. So take a look. As Dr. Mike said, I know all these systems are doing what we can to combat this virus, and there's a lot of walk-in vaccine options, like I said, Gulfport, Pascagoula, and then in Gulfport and Ocean Springs as well, and along with what they're doing there. So,
well, thank you, Dr. Mike. Really quickly as well, we know you came to the coast just recently, about 6 to 7 weeks ago, which was right when Delta was popping up around here. How has your I guess experience been as a new member of the coast with all of this?
It's been quite different. It's not really what I expected. I came most recently from Central Florida area, so we had a little bit of a Delta wave too, but not as severe as the Gulf Coast here, because our vaccine rates were markedly higher than what's going on in the Gulf Coast. But I'm very proud of the fact that the vaccine rates have steadily increased, even for the employees at the hospitals. They have greatly increased over the 7 weeks that I've been here. So that's just been phenomenal, really. Everyone has seen what's happened, risen to the occasion, and done the right thing. And I think that's a great thing. It really speaks to the community that we have here in the Gulf Coast. Everyone wants to do the right thing now that they see that, because this Delta wave is different. It doesn't seem like Mississippi got hit as hard as other areas of the country the first time when you looked at things that were going on in New York and California and a little bit of Florida even. But once it really hit home with the Delta wave, everyone got together and just pivoted and responded to the need. I think that just speaks a lot to the character of the people here.
Well, great. Thank you both so much for speaking today and sharing what you know. And thanks to our viewers for joining us and asking some great questions. You can find some more COVID coverage at www.sunherald.com. News coronavirus. My name is Isabella Murray, the vaccine reporter for the Sun Herald. You can support our work covering the pandemic and support community conversations like this by subscribing to the Sun Herald. Have a good afternoon, and thank you guys.